Your cup of coffee is not just another drink to supercharge your energy during office breaks. It's not just another way to keep yourself alert and awake during the night. Your coffee, which contains caffeine, decreases your risk of kidney stone formation. A new study published November 2014 by the American Journal of Clinical Nutrition reveals that people who drink caffeinated drinks, like tea and coffee, have a 26 to 31% lower risk of having kidney stones compared to people who don't drink these. Caffeine is a bitter-tasting substance found in tea, coffee, soda drinks, chocolates, and cola nuts. Some medications may also contain caffeine. It's considered both a drug and a food additive. Caffeine stimulates the central nervous system, which is the brain and spinal cord. It can change the way the brain works and can alter the way a person behaves and feels, according to the U.S. Food and Drug Authority. Most people can tolerate the amount of caffeine in 2 to 4 cups of coffee every single day. However, too much caffeine consumption results in jitteriness, difficulty falling asleep, headaches, dizziness, dehydration, and palpitations. Some people may even develop dependency to caffeine. Caffeine results in higher amounts of urine calcium, which is a risk factor for kidney stone formation. However, since caffeine intake also increases the urine volume, the calcium saturation becomes less. In fact, according to the said study, published by the American Journal of Clinical Nutrition, caffeine intake increases the urine output by 23% at 2 hours. Coffee, aside from having caffeine, also contains antioxidants, substances that reduce the damaging effects of oxygen, and it also has anti-inflammatory properties, the characteristic of certain substances that inhibits swelling. It's also rich in magnesium, an electrolyte that decreases kidney stone formation, according to a study published by Urology. 90% of the global population uses caffeine in one form or another. In the US, 83% of adults drink coffee, according to the National Coffee Association USA. The US Food and Drug Authority states that an average adult takes in about 200 milligrams of caffeine per day. That's almost equal to the amount of caffeine found in 4 cans of soda or 2 5-ounce cups of coffee.